Hello, and welcome to this Microbiology Bio 203 video lecture of Chapter 23 of your OpenStax book, Urogenital System Infections. I'm Mr. Kennedy, and I'll be your guide as we explore this topic together. Learning outcomes for Chapter 23 include describing the major urogenital system infections caused by bacteria, viruses, fungus, helminths, and protozoan. We begin first by reviewing what is the urogenital system. The urogenital system is comprised of the urinary tract and reproductive system. It is open to the environment and prone to infections. UTIs and STDs are very common. Anatomical differences between males and females vary the risk between the genders. There is a higher UTI risk of infection for females. This is an illustration of the anatomy of the urinary tract, which includes the kidneys, ureter, bladder, and urethra. The urethra in females is shorter than in males. The males overlap with their reproductive system. This is an illustration of the kidney down to the primary filtration unit of the kidney, known as the nephron. Normal microbiota of the urogenital system. The kidneys are sterile and have a flushing action of urine to maintain that sterile environment. In males, the distal urethra expels urine from the body. The bacteria present here is typical of the skin. In females, the urethra and vagina contain lactic acid producing bacteria, mostly lactobacilli. These use glycogen from epithelial cells and depend on estrogen. They confer protection by occupying the niche and producing an acidic pH. Low estrogen, as a result of pregnancy or menopause, predisposes one to infections. Cystitis. Cystitis is an infection of the bladder. Dysuria, pyuria, hematuria are all results of this type of infection. Painful pus and blood in the urine can be seen as symptoms of this infection. It is more common in females. Gram-negative bacteria such as E. coli, Proteus vulgaris, Pseudomonas aeruginosus, and Klebsiella pneumoniae are often causes of this type of infection. Gram-positive bacteria such as Staphylococcus, Enterococcus, and Streptococcus can also cause this infection. Pyelonephritis and glomerulonephritis. These are kidney infections and form from the urinary tract through the bloodstream. From the urinary tract, E. coli can enter the kidney. Symptoms include fever, flank and back pain, and can result in scar tissue that may form in the kidneys, which requires aggressive treatment. Glomerulonephritis occurs in the glomerula of the nephrons. The glomeruli can be damaged from inflammation. S. pyrogenes is a frequent cause of this type of infection. Leptospirosis. Spirochete bacteria cause leptospirosis. Transmission occurs because of contact with animals. It is rare in the United States, but endemic in Hawaii, and may lead to organ failure. Non-gonococcal urethritis, or NGU, is not associated with N-gonorrhea. Many women are asymptomatic, and it may cause discharge in males. It is spread to reproductive organs. Organisms such as chlamydia and mycoplasma are common causes of this type of infection. Bacterial vaginitis and vaginosis. Vaginitis is inflammation of the vagina. Vaginosis is an imbalance in the normal microbiota without inflammation. Gardnerella vaginalis is a common cause of this type of infection. Individuals may be asymptomatic or only show mild symptoms such as discharge. It's diagnosed through the use of clue cells, which are epithelial cells covered with bacteria. Gonorrhea. This is an STD caused by Neisseria. Neisseria are organisms with fimbriae that help with attachment. Many who carry or are infected with Neisseria are asymptomatic. If left untreated, it may result in pelvic inflammatory disease. It can become symptomatic and present itself as endocarditis, meningitis, or arthritis. Chlamydia is caused by Chlamydia trachomatis. It is the most common reported STD. It is often asymptomatic but can cause serious complications in both males and females. Syphilis is caused by a gram-negative spirochete, treponema. It invades mucosa or through the skin breaks. It has 3 stages: a primary, secondary, and tertiary stage. In the primary stage, a chancre lesion on the genitalia can be visible. In the secondary stage, rashes form. Then an individual enters the latent period. In the tertiary stage, nervous system damage occurs, and this can occur as many as 10 to 20 years after the initial infection. Genital herpes. Herpes simplex virus is an enveloped DNA virus. There are 2 types, HSV1 and HSV2. HSV1 causes the oral lesions known as cold sores, while HSV2 is genital herpes. Genital herpes can cause painful vesicles or lesions to form on the genitalia. The virus can become latent and cause recurring infections throughout a person's life. There is no cure, but acyclovir can help keep it dormant. Human papillomavirus, or HPV, is a small, non-enveloped DNA virus. There are many strains which all cause genital warts. Some types are associated to cervical and other cancers. There are vaccines such as Gardasil to help protect against it. This table summarizes the viral infections of the reproductive tract. At this point, I would encourage you to pause the video to familiarize yourself with the disease, the pathogens, the signs, symptoms, transmission, diagnostic tests, and drugs or vaccines that are available to treat or prevent the disease. Candidiasis. Candidiasis is a fungal infection caused by the genus Candida. If the normal vaginal microbiota is disrupted, Candida can grow in numbers. Antibiotics, diabetics, pregnancy, or immunosuppression create added risk for Candida infection. Trichomoniasis. Trichomoniasis is caused by a flagellated protozoan, Trichomoniasis vaginalis. Trichomoniasis protozoan can be found in semen or urine of male carriers. Vaginal infection causes irritation and a profuse, foul, greenish-yellow frothy discharge. It can be treated with metronidazole. And this brings us to the end of Chapter 23, Urogenital System Infections.